Hey, Joe, could you step out here for just a second?
Sure.
Thanks. So what you see here is I've got this all set up because I know you're going to be doing ostomy care on Mr. Kirkland, and I know that this is your first time. So before you go in and do this, I would like you to show me exactly what it is that you're going to be doing for him. That way you can go through the skill while I'm standing here and get yourself really comfortable so that it'll go very smoothly when you go take care of Mr. Kirkland.
Okay.
So if you wouldn't mind, I've got all your supplies right here. And so just go ahead and using these, please show and tell me what you would do.
All right. First off, I would introduce myself to the patient and let him be aware of what we're about to do and let him tell me anything I need to know about his ostomy that might be different from a normal one.
Okay.
All right. Then, of course, I would do hand hygiene, and then I would put my gloves on to protect myself and to protect him. All right. Once I have my gloves on, I want to place a Chuck's pad under the patient, help protect in case we have any leakage or spillage.
Good.
And then I'm going to cover up the front of the patient to provide privacy.
Good.
All right. After that, I'm going to clean the ostomy. I'm going to do that with just some warm water on a washcloth. Just clean around it, make sure I get any residual tape or glue that might be left over.
Okay.
Get that out of the way. And next, I'm going to have to actually measure the ostomy so I know what size to use. So I'm going to use this and place it over the ostomy and see which size I will need to cut in my actual ostomy patch.
Okay.
Then once I figure out the size, I'm going to trace it on the ostomy patch. All right, so after I trace it, then I'll know exactly where I need to cut it, and I'll take it out of its packaging and cut around so where the opening fits around the ostomy so I can place the patch right on it. Then I'm going to take the backing off of this, apply it directly to the patient, and then press all the way around it so there's no leakage.
Good.
Once I have that on there, I'm going to take the ostomy bag, I'm going to patch it out a little bit, make sure it's right, make sure it's closed, and then I'm going to fit it over the ostomy and lock it and make sure it's securely on there. And I believe that should be it.
Very good, very good. That should work very well. So I would like you to now go take all of these supplies, take it into the room, and do exactly what you just showed me with Mr. Kirkland. And I'll be close, but we'll talk about how you do after you're all done.
All right, excellent. Hello, Mr. Kirkland. My name is Joe. I'm your nursing student for today. We're going to go over and prepare some ostomy care for you.
Hey, Joe, come on over. Let me
Sure.
give you a little bit of feedback on the procedure that you just did for Mr. Kirkland. So how do you think you did?
I think overall it went well. I might have chosen a little too big of a ostomy hole. I think I could have went a little smaller. And it was a little difficult to actually attach the bag once I got to working with it.
Oh, okay. And those are some things that as the more you do, that you'll get a feel for how much pressure and how, what that takes to get a good seal on those. So when we set up the station and had you walk through it and actually use the tools, did you find that helpful?
Yeah, very helpful. Instead of just going over it verbally with you, actually touching the materials and walking it through with my hands and in my head at the same time made the process a lot easier. But I normally learn that way. I'm more of a hands-on person, so doing anything like that always helps me out.
Good. That's good to know. We can use that for any future types of skills that we'll be going over also. So that's good. As you're doing this procedure, one of the things we always look at is the skin. What kinds of things would we be looking for?
Probably more looking for a breakdown of the skin because there's so much adhesive going on and coming off repeatedly. Look at that, and then look at the ostomy itself. Make sure there's not obsessive bleeding. I mean, I know a little bit's normal, but kind of just the whole area right in there.
Very good. And what did you see with this patient?
This patient seemed like they took really good care of themselves. There wasn't any skin breakdown and just a normal amount of bleeding once I got in there and started cleaning.
Good. Good to know. That's very important to keep an eye out for because we don't want any infections, and skin integrity is a huge part of what we assess when we're doing this skill. So you did a wonderful job. I think that in the future, if you needed to, you could probably do that without my supervision.
Thank you.
All right. So Kirsten, I understand that you are going to be doing inserting a Foley in your patient this afternoon, and I just wanted to go over the procedure with you to make sure that you're feeling pretty comfortable about this procedure?
Okay. Well, I actually made a list based off of what you told me
Good.
earlier.
All right.
And I'd like to go over it and then kind of verbally go over how you think I've got it laid out, if you think I'm going to do all right with it. So here's,
All right. So
here's the
Jeff,
first thing I have.
it looks good.
Okay, great. Hi, Mr. Kirkland. How are you doing?
Good.
Good. So I came in a little bit earlier and told you I'd be coming back. I'm going to go ahead and insert a Foley catheter right now. Did your doctor tell you you'd be getting one?
Yeah.
Okay, great. So we're just going to clean everything up, and we'll be putting a tube up into your bladder so that you don't have to get out of bed all the time to go to the bathroom. Do you have any questions?
No.
All right, great. Well, we'll get started. How are you feeling?
I'm feeling a little pressure.
Okay, that's all right. It's completely normal to have a little bit of pressure, but if you have pain, you need to let me know right away, okay?
Okay.
Okay, I'm going to go ahead and cover you back up. Do you need anything before I step back out for a bit?
No.
Great.
All right, Kirsten, before you move on to your next thing, let's just do a real quick. How do you think you did with that?
I was pretty nervous, but I think overall it went all right.
Okay.
How do you get over being nervous?
The more you do it, the better you get at it, and the more confident you feel about your skill. Though sometimes we can be very good at something and we'll go in and we'll struggle with it because the patient is different. And so even though I know I can do it well, they're a little bit different, and so it can cause a little bit of apprehension. But just know that you can do this. And you want to demonstrate that sense of confidence because your patient will pick up on that. So just go in and say, I'm going to do this, and we're going to get through it quickly, and it'll be uncomfortable, but we'll do it as fast as we can and get this done and over with. The better for you and for the patient. I know that you had made a list of the steps before you actually went in. Did you follow that list?
I think I did pretty good.
All right. I didn't see anything that you really had out of order.
Okay.
You started out with a good sterile technique, and so is that your list?
This is
All
my
right.
list if you want to look at it.
So you have your list here, and as I go down the list, and I see that it's established a relationship with your patient, and then open your kit, put on your gloves, maintain a sterile field, and then get your supplies ready, move up the Foley, insert the Foley, look for flashback, or look for urine return, and then blow up the bulb. The patient said he was experiencing a little bit of pressure. I like the fact that you said that was normal, and letting him know that if he has pain that he needs to let you know, which is always very good. Be sure that you do go back and check on him. You told him you would, so it's very, very important to do that. Patients are expecting you. If you say, I'll be back, they're expecting you to come back. So
Okay.
at some point you need to just stop in and say, how are you feeling? Still, and he might still say that he has a little bit of pressure, which is still normal, but just kind of check in with him because that's what you said you were going to do.
Okay, that
All
sounds
right?
great.
You
Thanks.
did a nice job.
Thank you.
Good.